Hi, and welcome to our Community Health Project for the RN-BSN program at Brigham Young University-Idaho. This project is brought to you by Sarah Wright, Adam Byington, and Robert Bardsley. We will be discussing measles, mumps, and rubella, chlamydia, and smallpox. Measles, mumps, and rubella, otherwise known as MMR, has been in the spotlight recently with talk about the MMR vaccine and it causing autism. We will not get into that debate today. However, we believe it would be important for parents to know the signs and symptoms of these illnesses so that they can make the best decision for their children. Education is key, and we hope to give some information so that you can make healthy choices for yourself and your family. Measles, mumps, and rubella are caused by viruses. Antibiotics are not useful for viruses. Transmission is caused by airborne droplets from coughing, sneezing, or talking. You can also contract the virus just by sharing cups and utensils with someone else, or even touching something that is contaminated and then touching your nose, mouth, or face. Prevention of these illnesses is paramount since antibiotics are not useful. Infected people should stay home if experiencing symptoms. Please be considerate of others. Proper hand washing and good respiratory hygiene, like coughing or sneezing into a tissue or a sleeve, are also just as important. Those already having had the infection will have a lifelong immunity or protection. However, the most sure way to prevent the illness and the complications that come along is to receive your MMR vaccine. Now we will discuss these illnesses individually, and we'll start with measles. Measles is a miserable illness. Children who are sick are inconsolable and have trouble breathing and sleeping. Symptoms include a high fever, cough, runny nose, red, watery, irritated eyes. They also develop tiny white spots called Koplik spots inside their mouth about 2 to 3 days after symptoms begin. The most prominent symptom of measles is the flat red spotted rash. Starts on their face and then spreads downward to their extremities, trunk. This rash starts 3 to 5 days after symptoms begin. The measles illness is highly contagious. The Center for Disease Control Prevention, or CDC, has even found that 90% of non-immune people around the affected person will contract the illness. That means 90% of the people who have not received immunity or have not gotten the measles virus will contract the virus. It is so important to stay home and away from others. As always, children, the elderly, and those whose immune systems are compromised in any way are at most risk of getting sick. Please, again, be considerate of others if you are showing signs and symptoms of measles. Complications can develop from the measles illness. Those that are 5 years old or younger and older than 20 years old are at most risk for developing complications. That is a huge window for problems. The most common complication is that 1 in 10 children will develop an ear infection that may cause permanent hearing loss. Some more severe complications that can come about is that 1 in 20 children will develop pneumonia. This pneumonia is secondary to the measles illness and is the most common cause of death in children with measles. 1 in 1,000 children will develop encephalitis or swelling of the brain. This can lead to convulsions, which can cause deafness and intellectual disability. Pregnant women who contract the measles virus can give birth prematurely, or their babies can be of low birth weight. Now we will discuss mumps. Mumps signs and symptoms include fever, headache, muscle aches, fatigue, and loss of appetite. The most prominent and publicly known symptom of mumps is the swollen tender salivary glands under the ears on one or both sides of the jaw. This is also known as parotitis. 30 to 40% of those infected with mumps will not develop parotitis. Mumps has a long incubation period from the time that you're exposed to the virus to when symptoms appear, which is usually 16 to 18 days after your exposure. However, it can go anywhere from 12 to 25 days. Usually, these symptoms are very mild, and some people have no symptoms at all. They don't even know they're sick. Recovery can take a few weeks. The infected person can spread the virus before the salivary glands begin to swell and up to 5 days after swelling begins. An infected person can also spread the virus without even developing any symptoms or knowing that they're ill. Complications can occur, especially in affected adults. Inflammation of the testicles in males for those who have reached puberty, inflammation of the brain, inflammation of the tissue covering the brain and spinal cord, otherwise known as meningitis, inflammation of the ovaries and or breast tissue, inflammation of the pancreas, and deafness are included in these complications. We will now discuss rubella. Rubella is a lesser known illness that is covered by the MMR vaccine. Signs and symptoms include a red rash, which is typically the first sign. Starts on the face, spreads downwards just like measles, lasts about 3 days though. Other symptoms appear 1 to 5 days after the rash appears and include a low-grade fever, headache, mild pink eye, general discomfort, malaise, swollen and large lymph nodes, cough, and a runny nose. However, 25 to 50% of people infected with rubella will not have any symptoms. Rubella does have some pretty severe and heartbreaking complications. Most severe complications of rubella are found not with the infected woman, but with her unborn child. Rubella can cause a miscarriage or cause the baby to die shortly after birth. Mom can pass the virus on to baby, which can cause some pretty major birth defects, such as heart problems, loss of hearing and eyesight, intellectual disability, and liver and spleen damage. These serious birth defects, otherwise known as congenital rubella syndrome, are more common if infected early on in the pregnancy. This is a troubling complication considering 25 to 50% do not even develop symptoms of rubella and may not know that they're ill. Some more lesser severe complications include arthritis in women, rare brain infections, and bleeding problems. We'll now discuss some basic facts about the MMR vaccine. So when should we get the MMR vaccine? Recommendations for administration: the first dose is to be given at 12 to 15 months old, and the second dose is given at 4 to 6 years old. 2 doses are required for maximum coverage. The MMR vaccine is given later than other vaccines because antibodies from mom are sufficient to protect baby against the virus. They can even render the vaccine ineffective if given before the year mark. Contraindications for immunizations include those with allergies to a previous MMR vaccine and all components of the vaccine, those with an allergy to neomycin, and those that are sick at the time of injection should wait until they're feeling better. Pregnant women should wait until after delivery. They can get the vaccine while they're breastfeeding, as the vaccine components do not cross into breast milk. Those that are immunocompromised and or suppressed in any way should avoid the vaccine. So we've talked a lot about who needs the vaccine, contraindications, and the importance of it, but there are those who do not need the vaccine, and that includes those with documentation of 2-dose administration, blood tests confirming immunity to measles, mumps, and rubella, laboratory confirmation of past measles, mumps, rubella infection, and those that were born before 1957, as they are presumed to have been infected with or without symptoms and therefore have the lifelong immunity. So what is the effectiveness of the vaccine? With 2 doses, 97% effective against measles and 88% effective against mumps. 1 dose is 91% effective against measles, 78% against mumps, 97% against rubella. Those vaccinated can still become infected. Vaccinations help to reduce the duration of illness, limit the spread of the illness, and the size of population infected. Herd immunity is when everybody gets the vaccine. And it means that everybody has a lesser chance of contracting the illness as well as spreading it. Since we are having this debate about the effectiveness of the vaccine and whether it is causing autism or not, there are many people who are not vaccinating their children or themselves. The herd immunity is a very fragile system, and it is depleting because of those that are not being vaccinated. It is very, very important that you do your research, become educated, and make the best decision for yourself. If that decision is that you choose to not become vaccinated, or you do not choose to vaccinate yourself or your children, then you run the risk of contracting the illnesses and then spreading it to either your loved ones, strangers, even your children. It is very, very important that we know the signs and symptoms of the illnesses. That way we can stay home, use preventative measures, and not spread the illness any farther to as little people as possible. There are some requirements for the vaccine. All 50 states, including the District of Columbia, have state laws requiring minimum immunizations safe for childcare and public schools. These children that are not vaccinated, it's becoming very difficult for them to attend daycare and public schools. There are no current federal laws that exist requiring vaccinations. The following are the references for the information provided on measles, mumps, and rubella. We'll now take a look at chlamydia. Chlamydia is a common sexually transmitted infection. It's often overlooked. I think it's because it's so easily treated. However, it's caused by a bacteria called Chlamydia trachomatis. It does cause cervicitis in women, proctitis in men, and urethritis in both men and women. Chlamydial infections in women can lead to serious consequences, including pelvic inflammatory disease, tubal factor infertility, ectopic pregnancy, and chronic pelvic pain. It has also been more recently found as a cause of outbreaks of proctitis among men who have sex with other men. Chlamydia is one of the most frequently reported sexually transmitted infections in the United States. It's especially most common among young people, with 2/3 of new cases occurring among those aged 15 to 24 years old. It's also very common among men who have sexual contact with other men. Chlamydia is often overlooked and is known as the silent infection, as most people don't even know they're infected and they have no symptoms. In women, the bacteria initially infects the cervix, which can cause cervicitis and possibly urethritis. It can spread from the cervix to the upper reproductive tract, causing pelvic inflammatory disease. Symptoms include abdominal and pelvic pain, along with cervical, uterine, ovarian tenderness on examination. Men with symptoms often have urethritis with penile discharge and painful urination. It can also cause epididymitis, unilateral testicular pain, tenderness, and swelling. Complications from chlamydia in women come from untreated chlamydia, which can spread into the uterus and fallopian tubes and cause pelvic inflammatory disease, as discussed in previous slides. It can also cause permanent damage to the fallopian tubes, uterus, and surrounding tissues. This damage can lead to chronic pelvic pain, tubal factor infertility, and potentially fatal ectopic pregnancy. It can also affect the liver. In pregnant women, untreated chlamydia has been associated with preterm delivery, as well as ophthalmia neonatorum, conjunctivitis, and pneumonia in the newborn. Chlamydia is transmitted through genital contact of any kind. It can also infect the rectum in men and women who have anal sex. It can also be spread perinatally from an untreated mother to her baby during childbirth, as discussed previously. People who have had chlamydia and have been treated may get infected again if they have sexual contact with a person infected with chlamydia. There is no lifelong immunity. Once infected, you can be treated, but you can become infected again. Thankfully, chlamydia does have a treatment, and it can be treated with antibiotics. Persons with chlamydia should abstain from sexual activity for 7 days after the first dose of antibiotics or until the 7-day course of antibiotics is complete. This can prevent the spreading of the infection to partners. Although medication will cure the infection, it will not repair any permanent damage done by the disease if left untreated. Repeat infections with chlamydia are still possible. Medication will not prevent another infection. Babies with conjunctivitis or pneumonia caused by chlamydial exposure should also receive treatment for those infections as well. So who is at risk? Everybody. Everybody who has sex with another person who may be infected with chlamydia is at risk of contracting chlamydia. How can we prevent chlamydia? The safest way to avoid chlamydia is to abstain from intercourse with someone who has it. Plain and simple. Don't sleep with someone who may be infected with chlamydia or any other type of STI or sexually transmitted infections or diseases. Take care of yourself. You're the only one who will. We'll now discuss smallpox. It's not a disease that we see at all because it has been eradicated from the world. Some very minor pockets will show up in underdeveloped countries. However, they are quickly controlled with medications and vaccinations. Smallpox, the eradication of smallpox, is a shining example of what public health research and administration is capable of. Let's see how they did it. Smallpox is a very deadly disease, can be dated back as far as 3 BC, and it has been taking its toll on the world since. Smallpox had a 30% mortality rate and would leave its survivors with large divots and scars all over their bodies. One reason smallpox is so deadly is due to the fact that it is highly contagious for a long amount of time. Smallpox can be spread through airborne droplets in the early stages of the disease and then becomes contact and vector contagious or contagious through physical contact for the rest of the disease process or until the scabs fall off. This disease process can take 3 or more weeks to complete, which means that you are contagious for the entire time. The incubation period, or period between first exposure and signs of infection, is about 2 weeks. The first signs of the disease include a headache, high fever, and sometimes nausea. Next is when the first rash appears. The rash continues on until full-blown bulbs and pustules form and can cover the entire body. Finally, the pustules dry up and form scabs, which then fall off. The history of smallpox is interesting. The first smallpox vaccine was discovered around the year 1800 by Dr. Edward Jenner. The vaccine has been changed since then to best immunize against smallpox. About 150 years later, the World Health Organization started their global campaign to eradicate smallpox, and by 1977 they had eliminated smallpox from being naturally spread in every country in the world. Through their efforts, on May 8, 1980, the World Health Organization declared the world free from smallpox. There are some potential problems, though. Smallpox can only be found in a few tightly controlled laboratories that use it for research. Since there is still a live virus in this world, there is still a chance for smallpox to re-enter the public disease list. Terrorist threat is one possible source, another is just human error. In 2014, an uncontrolled sample of smallpox was found in a cold storage locker at a U.S. university that had been forgotten about. So let's talk about smallpox in our day. Today, countries do not routinely vaccinate their citizens for smallpox. The possibility that smallpox could be exposed to the public is considered smaller than the risks associated with revaccinating the whole population of the country. Currently, only military personnel and scientists dealing with the virus get vaccinated. We talked earlier about how smallpox has been eradicated from the world through public health initiative, and smallpox can be used as a template. Some people feel that we should study and use the processes used in eliminating smallpox from the world as a template to target other viruses and even rid the world completely of some other diseases. There is, however, big controversy about different ways to do this. In our day, the eradication of smallpox can help us understand how certain diseases can be eliminated from our communities if we have the right tools and community involvement to get it done. Thank you for your time in watching our presentation about measles, mumps, rubella, chlamydia, and smallpox. This public health initiative has been brought to you by the students from Brigham Young University RN-BSN program, Sarah Wright, Adam Byington, and Robert Bardsley. We hope that you got a little bit out of this and are able to make better decisions for yourself, for your health, and for your family. Please leave a comment for us. That way we know if this was helpful for you and how we may be able to help you in the future. Have a great day. Thanks.